Grapeseed extract. As the name implies, grapeseed extract is derived from the seeds of the grapevine. Now, there are many healthful substances in grapeseed extract, but probably the most important nutrient is something called proanthocyanidins. Now, proanthocyanidins are long chains of a polyphenol called a catechin. Catechins are the health-promoting substance found in green tea, white tea, and chocolate. So essentially you're taking these catechins and you're linking them together in these very long chains, and that's something called the proanthocyanidins. Grapeseed extract is a high-quality source of these proanthocyanidins, offering both a diversity of proanthocyanidins and also a very high quality. Many researchers believe that proanthocyanidins help explain the French paradox. Now, the French paradox is this concept that the French have a much higher consumption of animal products, and they have higher rates of smoking and tobacco use, but they have lower rates of cardiovascular disease. And some researchers believe their high consumption of wine and indirectly proanthocyanidins through grapes used in wine production helps reduce the risk of cardiovascular disease. So potentially, how does grapeseed extract enhance, stimulate, and promote musculoskeletal health? The exact mechanism isn't precisely known, but most authors believe that grapeseed extract helps reduce or diminish the amount of whole body oxidative stress and inflammation. Recall that chronic injury to bone, joint, tendon, muscle shares a common destructive pathway, at least in part, and that pathway is governed by unrelenting oxidative stress and chronic low-grade inflammation. So potentially grapeseed extract, more specifically proanthocyanidins, help mitigate this oxidative injury and inflammation. Grapeseed extract exhibits formidable antioxidant properties. Proanthocyanidins have been shown to reduce the synthesis and production of reactive oxygen species. And as the name would suggest, these are free radicals that are derived from oxygen. They are primarily generated in the mitochondria, the power generator of the cell, and they also are generated by the immune system to use as a weapon against invading pathogen. Sometimes these free radical oxygen species leak out of the mitochondria and target healthy DNA, proteins, and fat, causing dysfunction in the cell. Additionally, sometimes if the immune response is too exuberant and there's release of too many free radicals, they not only target invading pathogens, but also target healthy tissue that's found in bone, muscle, joint, and tendon. Examples of free radicals that grapeseed extract has been shown to reduce the synthesis of include the hydroxyl radical, hydrogen peroxide, and the superoxide anion. Grapeseed extract, proanthocyanidins, have also been shown to demonstrate anti-inflammatory properties. Proanthocyanidins have been shown to counteract inflammation via three main pathways. Number one is the blocking or thwarting of messenger molecules that help orchestrate the inflammatory process. And these molecules are released by immune cells or even cells within joint, muscle, bone, and tendon. Examples of these types of messenger molecules would be tumor necrosis factor alpha and certain types of interleukins. Additionally, proanthocyanidins have been shown to decrease the activity of the cell's internal machinery that produces proteins and other signaling molecules that amplify and magnify the inflammatory process. It likely does this by somehow inhibiting the activity of a transcription factor called nuclear factor kappa beta. Finally, proanthocyanidins have been shown to reduce the synthesis of very special types of enzymes called matrix metalloproteases that actually attack tissue, musculoskeletal tissue, such as tendon, bone, muscle, and cartilage tissue, and literally dissolves it and eats it away. So what do laboratory studies suggest about the use of proanthocyanidins and musculoskeletal health? Number one, research suggests that proanthocyanidins can support enhance joint health. Researchers in Japan evaluated the use of a proanthocyanidin derivative on a mouse model of osteoarthritis. And what they found is that when the mice received daily oral proanthocyanidins, that their articular cartilage was somewhat protected from degenerative joint injury, and there were less cartilage cells dying. Grapeseed extract has been shown to boost bone health. Researchers in Japan, looking at a rat model of osteoporosis, found that administration of a grapeseed extract to rats increased their bone density and decreased the likelihood of bone fracture compared to a control group that did not receive grapeseed extract. Thirdly, grapeseed extract may support muscle health. Researchers at Washington State University evaluated the effect of grapeseed extract on a rat model of muscle loss. What they found was when they administered this grapeseed extract, the rats showed increased muscle mass and less protein degradation and less muscle cell death compared to a control group that did not receive any grapeseed extract. Grapeseed extract is generally well tolerated by most individuals. Prior to consideration of supplementation, please consult with a qualified health practitioner familiar with your unique medical history.